Hey guys, welcome back. I am so happy to finally be filming again. It has been like 2 weeks, I think, has it? Yeah, it's been about 2 weeks since I actually sat down here. It's been about a week since I've actually been in this room. I just haven't made it to the basement yet since I got home from hospital, and I'm here and I feel good. And it has been 1 week since my surgery, and so I thought we would do a chit chat, get ready with me. I'll explain sort of what's been happening in the last week, put some stuff on my face, and then we can all go about our days. My days lately consist of sitting on the couch and watching The Good Place, but I'm not complaining, I'll take it. Okay, yeah, I could do multiple takes of this, but I don't know that it's gonna get any better. Let's just do this, shall we? Let's do this. If you are new here, welcome. I have already mentioned this, but last week I underwent gastric bypass surgery. It is something that I've been thinking about doing for literally years. I was actually in the program for it in 2016, and at that time in my head, I was like, okay, I'm either going to have the surgery or I'm finally going to get pregnant with our second child, and then whichever one happens, there it is. Because you're not supposed to get pregnant for about 2 years after you have the surgery and just age and all that. It was going to be one or the other. And thankfully, I got pregnant. So that put the gastric bypass on hold. And then I re-entered the program back December of 2018. So I live in Ontario, Canada, and we are lucky enough to have something called OHIP, Ontario Health Insurance Plan, Program, Provider? I don't know, something. Universal healthcare, basically. And in order to have OHIP cover the cost of the surgery, there are certain criteria you have to meet, including being referred to the bariatric program by your primary care physician, which I was. So I didn't have to pay for this surgery, which is incredible because if I had to, I wouldn't have had it done because it's like $20,000. So that is what I refer to as the program. There are only select clinics in Ontario. I think there's 6 or 7 of them that actually perform the surgery. And there is one that is like about a 45-minute to an hour drive away from me. So I'm lucky in that regard. So I met the surgeon in April, and then there's a whole other series of professionals that you have to meet. So you have to meet the nurse, a social worker, an internal medicine specialist, and a dietitian, and all of those people have to approve you for the surgery as well. Obviously, I was improved. Well, yes, but approved is the word I'm looking for in this context. So I was approved, and my surgery, okay, so I was approved finally on July 30th, July 31st, I can't remember, one of those, it doesn't matter, end of July. And I called my surgeon's office the following Tuesday because the Monday was a holiday. So the following Tuesday, and I was thinking I would have surgery in like November, maybe December of this year, and they informed me that they had a surgery date available on August 30th. And then the next available one was at the end of October. So I had a freak out, ultimately decided, let's just do this. And I chose the August 30th date, which meant, that was the Tuesday, which meant that on the Friday of that same week, I had to start my preoperative liquid diet using the OptiFast program. It was hard. The first like week and a half almost broke me, almost broke me. Barry would just sort of like back away and not make any sudden movements around me because I was a little unpredictable. I was a little on edge, shall we say. I make no apologies, it was what it was, but it was very freaking hard. But I got through it. So then we get to August 30th. And my surgery was scheduled for 2 o'clock. So I was allowed to drink cranberry juice. They wanted me to drink a sugary drink 4 hours before the surgery time. So I got to drink some cranberry juice, which was like heaven in a cup. And then my surgery was put off until like 4:30, just from delays from previous surgeries that day. So I was very hungry by the time it happened, because I wasn't allowed to eat anything, but that's okay. So we go to the hospital, Barry comes with me, we check in, do the whole thing, and I'm in obviously the pre-op area, and they have to do an IV. Now, at every step along the way, I have told every doctor that I'm terrified of IVs. I have never had a good experience with them. I usually end up going into some level of shock where they need to bring like warmed blankets, and it's a whole thing. When I had my C-section with my son in 2017, I think it took 3 nurses multiple times each to get it right, and they finally just had to go in on my wrist because my hands just were not cooperative. So I've been telling everybody that. Surgeon, anesthesiologist, pre-op nurse, like anybody who will listen, I'm like, I'm terrified of IVs. Left hand doesn't work. Right hand sometimes does. Don't do the left hand. So we get to the pre-op center, and the nurse, I again tell her and say what I just said. Left hand doesn't work. It doesn't cooperate. My veins have been called, I think it's ropey. I don't know what that means, but it's not good. It means that it hurts like a son of a bitch when they try to put a needle in it. And she says, let me see your hands. And I show her. She's like, no, these look like good veins, blah, blah, blah. Don't psych yourself out too much. It's going to be fine, this and that and the other thing. So what does she do? She tries to put it in the left hand. And what do? Freak the hell out. I am writhing in pain because it's excruciating. Crying, and she's like, you're just psyching yourself out. You're making it harder than it needs to be, blah, 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 blah. And then she finally says, okay, you know the needle's out, right? I'm like, no, I don't, because my hand's on goddamn fire, so I can't tell if there's a needle in it or like 6,000 fire ants biting me simultaneously. So I look down, and sure enough, the needle is out, but like blood is gushing everywhere. Sorry, I guess I should have put a warning on here for anybody who's like sensitive to this kind of thing, but at any rate, she then moves over to the left hand and says, you need to just calm down. Okay, here, Taylor Swift, you need to shut your pie hole, because that doesn't help. So right hand in, no problem. Doesn't hurt. First try, 1 shot, 1 kill. My left hand, I don't know. Yeah, it'll show up. You see that gigantic bruise? That still hurts. The 5 incisions that I have on my abdomen don't. What does that tell you? Fucking left hand does not work for IVs. Listen to your patients. Don't tell them they're overreacting. Anyways, shortly after that, as I am collecting myself and trying not to sob like a baby, the surgeon comes in and says, oh, I see some tears. How are we doing? I was like, I am not afraid of what you're about to do. This chick scares me. And she did not like me very much after that. And feelings definitely mutual, my friend. It's all good. I don't like you either. So there was that. So I am trying very hard to compose myself. Thank God for Barry. And my hand hurt so badly, but I got through it, obviously. And about an hour after they started the IV, that's when they came to get me for surgery. And a very lovely nurse walked me to the OR, got me up on this operating table, and it was like a well-oiled machine. Like all the people just like, they're doing their thing and this and that and the other thing. And the anesthesiologist is lovely, and he explains exactly what he's doing, and then he says, okay, we're gonna start getting you to sleep. He says you might feel a little bit of stinging in your hand when the IV goes in, like the medicine. I didn't, thankfully. And then one little nurse leans over me and she's like, okay, have sweet dreams. And then I woke up in the recovery room. So like the surgery itself, I have I didn't have any fear. No, that's not true. I had like 1 second before they started like with the mask on my face and all that, where I thought, am I sure? And it was one of those like blind terror, like, do I really want to do this? And then it was gone. And I was like, yes, I do want to do this. I need to do this. So that was the extent of my anxiety and fear of the surgery itself. Was literally just a fleeting thought of like, wait just a second, am I ready? Yes, I am. Okay, let's do this. So not traumatic in the least. This was worse. So I wake up in recovery and Barry is there. And I don't remember much about that because I was like in and out and just trying to wake up. They came and they washed my face and gave me ice chips, which was lovely because my mouth was so dry. And then they wheeled me into a private room, which I thought I was going to be in like a ward or something, but I was in a private room. And the guy, the attending, or the what are they called? The guy that pushed the gurney, I don't know what his name is. He lines me up between the bed that I was on in recovery and the hospital bed in the room and it's like, okay, just shimmy over. I'm like, what? I can't do that. But I did. And it really wasn't all that painful. Like my only experience with surgery, really, I've had an appendectomy, which I was 18 for. I don't really remember much about it, to be honest. All I remember is waking up in recovery to a nurse saying, I'm going to give you a suppository for the pain, and me saying, no, oh, okay, because my objection was too late. Suppository was in. They did not suppositize me this time, so thank you for that. So I was then under the care of the nicest male nurse I've ever met. He was just so attentive. When I was in hospital for the last 2 times were for C-sections, and like C-sections are rough. They, like, any childbirth is rough, but C-sections are rough because they give you like Percocet, which knocks your ass out, but they're like, also you have a baby that you need to take care of. And the nurses, like, they're great for the first night, but then after that they're like, you again? I've got other things to do. At least that's been my experience. So I was kind of expecting that I was going to be a nuisance to him, and I never got that sense at all. He was very attentive. When my ice chips would run out, he would come and he would get more. He, you know, was very gentle in getting me out of the bed to go to the bathroom, and made sure that I had like a house coat on because I still had the Johnny shirt and my ass was hanging out in the breeze. So that it was very private, and he was just so respectful and so kind. And I just felt like I was in such good hands. The hospital room itself also had like a big couch that pulled out into a bed, and Barry was invited to just spend the night, which I wasn't expecting. And it, like, although he was asleep most of the times that I woke up during the night, it was so comforting just to know he was there, like that I wasn't completely alone. And like that, just from a patient experience, that just meant so much to me. The bed that I was on, I mean, I think of hospital beds as being not so great. This one was an utter delight. It was like self-inflating. I don't even know how to say it. Just basically anytime I would sort of maneuver myself and move, it would like add air underneath my knees or like give me more lumbar support. And it was just like a space age bed that I'm like, I would not mind having one of you at home because this is delightful. So overall, like, my stay in the hospital was fantastic. I really have no complaints. The nurse that took over for the night nurse, she was equally wonderful. We ended up like sharing pictures of our kids together and all this kind of stuff. And she was just like, she was a riot. And I felt good. For the most part, my pain was controlled just with children's Tylenol. Don't know why they gave me children's and not adult. I don't know. There must be some medical reason for that. But that was basically the extent of my pain. I did have, I think I took maybe 3 oxys in total over the first 3 days, like 1 a day for the first 3 days. And then I just stopped taking them because I don't need them and they're a harsh drug, so I don't really want to be pumping myself full of oxy if I don't actually need it. By contrast, I was on Percocet for about a week after I had my C-section with Bennett. And I was not as bad with Aspen, but I was on Tylenol 3s with her for about a week. So this surgery has been much easier to recover from than a C-section, which I kind of anticipated because it's laparoscopic, but I'm also just very happy to note that because I was worried about the pain. I mean, anybody would be, right? So it hasn't been bad at all. For the first few nights, I couldn't lie on my side. Like I just had to lie on my back, and I'm not a back sleeper. So there was a lot of awake time for me, but the last 2 nights I've been able to fall asleep on my side and no pain in that regard. So yay. I haven't really had a hard time at home, physically. Anyways, emotionally we'll get into. It's like I move slowly and, you know, I have to kind of rest with a bunch of pillows kind of supporting my back and things like that. And by the end of the night, like I'm ready for bed at about 10:30, which is different for me because I'm usually a night owl and I'm up until midnight at the very earliest usually. But I'm not complaining because I'm getting much better sleep than I ever have. And Barry actually, it's gonna sound creepy, but he took a video of me sleeping this morning and I'm on my side and I'm not snoring. Like I've got like the deep breathing going on, but no snoring. So just 3 weeks of liquid diet and 1 week post-op and my snoring has pretty much resolved, which is insane. And that's so exciting because that was like my big motivation was like, fuck you, sleep apnea, because I don't want to wear that machine. So that is a very exciting non-scale victory. So yeah. Okay, so then physically, no big deal. I've got 5 little incisions on my stomach. They may scar, they may not. I don't really care. My stomach doesn't see the light of day anyways, so I don't care. I have a C-section scar. I've got 2 C-section scars. They kind of crisscross each other, so like I'm, whatever. Doesn't bother me in the least. I'm up, I walk. I usually take 2 to 3 walks a day now, usually about 10 to 15 minutes each. I'm just concerned at this stage because it is only a week that I'm gonna walk like half an hour one way, but then I have to walk another half an hour back and that's gonna be too much. So I'm just taking it easy at this point and it will, you know, progress. Now, the emotional side of things has been a bit more of a trick, at least for the first few days. I can say that now I am settled and I am happy and I don't have any regrets at this point. Is it easy? No, but I don't regret it. Because any weight loss program, whether it's surgery, whether it's not, none of it's going to be easy. If weight loss was easy, there would be no obesity problems. That's somebody responded to one of my tweets. I had said that I was having surgery and Shane Dawson had responded, that's a whole other thing. I've got something to share about Shane Dawson as well. And she responds to Shane Dawson, or she could just stop eating bullshit. I'm just like, you did it. You have solved the mystery of the obesity epidemic. Like, there it is. You need to bottle that and sell it. You dummy. If it was that easy, would anybody be overweight? Like, come on. Anyways, whatever. Anyways, emotionally, it's been a little bit of a ride. So I'm gonna set my face, prime my lids, we'll come back, do eyeshadow, and I'll share sort of the emotional side of it and also a little bit more of like what eating looks like at this point to me. All right, so in the hospital, I was just so excited. I was so happy that I had actually done it, it still is very surreal to me that I actually have had this surgery. I've been thinking about it for so long, and it's been such a long process that it's just very surreal that it's finally happened. So I was feeling very good, very happy, totally at peace with what I'd done, a little disbelieving, but okay. I came home on the Saturday night. I had a bout of nausea. It wasn't actually sick to my stomach, but I had like, when you end up like excessive drooling and all that, I had that going on, and I just felt super crummy just before I went to bed. And that kind of shook the happiness out of me. And I became very concerned about what it was that I had actually done to myself. And that carried over for the next couple of days. It was like buyer's remorse. Like, I was like, what have I done? What have I done? I need to go back. I need to have it reversed. Like, this is insane. What have I done? And all that really got me through those few days were Barry, frankly, saying, you did what you needed to do. And then me really thinking about the efforts I've put into getting healthy over the last, almost 20 years, and none of them have been successful. And I know unequivocally that I would not be successful without this surgery as a tool. And I managed to find some online support groups. And I have one, it's like a Facebook group chat basically, and the ladies in there are all at different levels, they've had their surgeries at different times, but they've all been through it. And talking with them and having them say like what it is that you're feeling is totally normal. Like, so many of us go through that. It's going to be okay. It passes. Watching videos on YouTube as well. The ones that do talk about the negative, there's a lot that don't. And that's why I'm trying to be so open about this whole process, is that maybe it'll help somebody. Because I don't ever want to come on here and say, it's been amazing. It's been the best thing ever. It's super easy, life-changing, like all that kind of stuff. Because I mean, it is life-changing and it is amazing, but it's not easy. And I don't want to give the impression that it is, because that's just not fair. And so that's what I'm trying to do by sharing my experiences. And keep in mind, it is just my experience. Everybody's going to handle it differently. Everybody's going to struggle with different things. Some people are very nauseous for a very long time afterwards. Thankfully, that does not seem to be the route that I'm going to be taking, and I'm so grateful for that. So going back to the emotional side of it, there were a good solid 2 to 3 days where I just, like, the thought just kept coming up of like, what the hell have you done to yourself? And I mean, it's hard. Like, I'm still on a liquid diet. It's not the protein shakes anymore. It's what they call the full fluids. So it doesn't have to be like transparent fluids. Like, it doesn't have to just be broth. I can eat cream of potato soup has been like my go-to lately, just because the flavor works for me. Cream of broccoli as well. I have yogurt. I did try cottage cheese, but it's honestly just not my jam. Like, I just couldn't palate it, so didn't bother with that. I can eat stuff like applesauce, anything that's like really, really almost liquidy, but I tend not to eat a lot of applesauce because it doesn't have a lot of protein, and I'm trying to focus on protein before anything else. I have been having bone broth as well, and that's been really helpful because protein drinks and everything are all sweet, and I am more of a savory lover. So just drinking all this sweet stuff is just, it's too much for me. Like, it's all cloying. So I slowly started getting out of that. And I mean, it's a learning process too, just learning what my body cues are, because I'm not hungry anymore. Like, I don't feel hunger basically ever. but I can't just not eat. I need to, like I said, get the protein in so that my body heals from the inside. Food is still like, Barry and the kids eat, and I wish I could. I will get there eventually, and that's where it's going to become a challenge. Like, this is the easy part right now, because if I eat, like, say I eat a hamburger right now, first of all, my whole system's going to go the fuck, because I haven't had that kind of thing in my body for so long now. But also, I could rupture the stitches that are on my stomach, right? Like my new little pouch that they've made. And I'm not about to take that risk. So it's not even a thought to me. Like, it hasn't been a struggle of like cravings or anything, because I just don't even think about it right now, to be honest. But once I get into being able to eat foods, that's where it's going to be a challenge. And that's where it's going to be trying to create new habits for myself so that I don't regain the weight or stretch out my pouch or just fall back into what brought me to this in the first place. Also, I'm spending a lot of time alone, which is always my dream. Whenever I'm like around people, I'm like, ugh, I just want to be alone. And then I'm alone and it's great for like the first 3 hours. Then I'm like, I'm lonely. So I'm a complex creature. What can I say? So it has been lonely. The days do go by still alarmingly quickly, considering I really don't do anything at this point aside from go for walks and watch Netflix. But like, thank God for social media, honestly. Thank God. Like, there are just so many incredible people out there, you guys included, but like between YouTube, Instagram, Twitter, like my new Facebook support group that I'm in, I'm not really alone. Like, I'm really not. And it's been incredible. The amount of support I've received has just blown my mind. Like, I've posted pictures from when I started my OptiFast, and I took the pictures yesterday, so just about 4 weeks there. And I was terrified to post them, but I'm getting over that because it's a body in transition. It's just a body. I'll insert them while I'm talking. So I posted these all over socials. I posted them to my own Facebook, which my Facebook is just private. It's just for my family and like real life friends kind of deal. I hate saying real life friends. It's not really what I mean, but you get it. Like, the people that I know in reality, that I see, maybe not on a day-to-day basis, but like they actually know me. They're not people I've met online. And for some reason that makes me feel far more vulnerable than sharing with strangers. And like, I have received nothing but positive, amazing feedback on those pictures. And what I love are like the people that are commenting and saying like, you look happier, you have like a little bit of a smile going on, blah, 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 blah. And that is so true. I feel liberated in a way, and I feel happy. Like, I do. I feel happy. There's going to be challenges. I know it's a lifelong thing, right? There's always going to be challenges. And I've lost just about 30 pounds. And I can get up and down stairs easier. My snoring is all but gone already. I feel more confident in myself just knowing that I've done this. Like, this has been the hardest thing I've ever done. Aside from maybe bed rest, but that was different. Like, that was difficult in a whole other way because I had no control over the outcome of that. So that was difficult in that sense. But this one, like, I did it. I survived OptiFast. Like, holy Christ. If ever there should be like humanitarian awards, it should be for people who survive OptiFast without, committing homicide. But I'm just proud of what I've done so far. And I can't wait to see where I am a month from now, or 3 months, or fucking next year. I cannot imagine. Like, I'm turning 40 next June. my 40s are going to be so much different than my 30s, and I'm down for it. Like, I'm so excited for it, and I'm so incredibly grateful for the support that I've received here and on other social platforms. And yesterday, I mean, I was happy yesterday, but I was still just kind of like, I'm alone. And ding dong, there's somebody at the door, and I open it, it's the FedEx guy, and I was expecting this from Gerard Cosmetics. It's the mint chocolate chip. It smells so good. I was expecting that. There it was, but then there's this like giant box underneath it, and I'm like, I could have ordered that. This is a strong possibility. I lose sight of what I've ordered. But I didn't recognize the brand, and it was addressed to Kara C, and I don't address myself as Kara C. So I brought it in, opened it up. So inside is this like suede box from, what's it called? Venus et Fleur. And there's all these insanely beautiful roses in it. And they smell like heaven. Like it's so beautiful. So I'm like, I didn't order these for me. I'm pretty sure Barry didn't order them for me. Who did they come from? So I'm digging around, and then I find the little card, and inside there is the message. Shane Dawson sent me flowers. And I damn near lost my mind. Like, may have cried. Read as I cried. It's just, Shane Dawson sent me roses. Like, never in my life did I think I would ever say that sentence and actually mean it. But, like, how thoughtful and generous and just purely kind is that? Like, that is insane to me. And in case anybody's wondering how he has my address, that is related to something else, so that's totally fine. It's not like I was creeped out that flowers arrived at my house from a YouTuber that I've never actually met in person, so it's all good. So I've had a ton of support, and like people sending me emails and DMs and leaving comments here, and tweets just asking how I'm doing. It all means so much to me. And every time I get one, and like there's people that have told me that I'm an inspiration, which, thank you. I don't feel like I'm a particularly inspiring person, but I'm just me. I'm doing what I felt I had to do in order to achieve success with weight loss. And I'm doing it because I deserve to be healthy, and my family deserves me to be healthy. And I'm tired of being on the sidelines. I'm so tired of being the one to take the pictures. I'm so tired of being the bag holder while Aspen and Barry go on the rides. I don't begrudge them that, but I'm tired of taking on that role solely because I'm afraid that the merry-go-round won't hold me. You know what I mean? Like, I'm tired of that. I'm tired of not wanting to go on the long walks because I know how much my body will hurt. I'm tired of disappointing Aspen in that sense because I won't climb up on the play structures because, again, I don't think they'll hold me. Like, I want to live and not just exist. Like, I want to be fully engaged and be present in her memories and in Bennett's memories. Like, that's why I'm doing this. And the sleep apnea diagnosis was a huge wake-up call for me, and it came at the perfect time. It honestly did, because it has just kicked my butt through each step of this, and I'm so grateful for that. To be honest, everything does happen for a reason, and I truly believe that was the reason for me, was to be that motivation that I needed, and I'm so grateful. So that's sort of where I'm at right now. Like, I'm at peace with what I've done, Not everybody's ever going to understand why I took such a drastic route, and that's okay. They don't have to. You know, people might think it's the easy way out, and I don't care if they do. Like, I don't care if they do. People can think what they want. I've lived it, and I have a lot more living with it to do. I've only experienced the tip of the iceberg, and from what I have experienced, it is most definitely not easy, but it's so worth it. All right, I've been talking for an obscenely long time. I'm just going to finish up off camera. I just got to do liner, mascara, lipstick. I will come back and show you the final look, and then we will wrap up for today. Be right back. All right, and there is the final look. On my lips, I'm wearing one of the new Natasha Denona lipsticks in the shade Sava, and there we have it. If you have any questions for me about life before surgery, life after surgery so far, anything like that, anything I haven't covered that you are curious about, feel free to leave a question down below and I'm happy to answer. Basically an open book, so any question is completely acceptable. I'm totally fine answering virtually anything. I'll play that one by ear because I'm sure people can come up with some pretty creative stuff. But at any rate, feel free to leave your questions down below. And I just, again, want to thank you guys so much for all of your support and for checking in and for just making a girl feel so loved. So thank you, and thank you for taking the time to watch this video. I suspect it's going to be on the long side. I hope that's okay. And I will see you in my next one. Until then, guys, just be a decent human being. Bye for now.